In this podcast episode, Dr. Peter Salerno, a licensed psychotherapist and expert in personality disorders, discusses the complex nature of cluster B personality disorders, including narcissism, psychopathy, and related traits. The conversation delves into how these personalities manipulate reality, the biological and environmental roots of such disorders, their evolutionary background, and how they appear in interpersonal relationships. Dr. Salerno also explores the neurobiological factors behind these traits, the challenges in therapy, and the impact on victims. Throughout, he challenges common misconceptions and provides nuanced insights into detecting, understanding, and coping with these difficult personalities. Dr. Peter Salerno introduces his expertise in researching personality disorders, emphasizing not just treatment, but helping victims restore their reality confidence after toxic relationships. He explains that individuals victimized by manipulative personalities often lose their grasp on what is real, trapped in traumatic cognitive dissonance, holding contradictory truths simultaneously because of the manipulator's deception. His work involves helping people disentangle what genuinely happened from what they were coerced to believe for someone else's benefit. Cluster B disorders include personality types characterized primarily by dramatic, erratic, and manipulative behaviors. Dr. Salerno notes that these disorders frequently overlap, making it difficult to cleanly categorize an individual. Central to these disorders is antagonism, a trait marked by deliberate actions to create conflict, manipulate others, and deny accountability. This antagonism manifests in tactics like triangulation, where the manipulator sows discord between others for personal advantage, often denying involvement to deepen confusion and control. Besides antagonism, cluster B individuals display hostility, deceit, manipulation, and failure to meet obligations consistently. Unlike occasional antagonistic behaviors we may all display, those with these disorders employ such strategies pervasively and intentionally, generating significant interpersonal strife. Dr. Salerno highlights that many labeled narcissists are often accused specifically of antagonistic traits like grandiosity, entitlement, and inability to see others as equals, necessary for maintaining their hierarchical worldview within relationships. Challenging the widely accepted theory that personality disorders primarily arise from childhood trauma or adversity, Dr. Salerno points to recent research showing significant genetic and biological contributions. Using twin studies as evidence, he explains that pathological personality traits demonstrate heritability often exceeding 50%, indicating a strong innate component alongside environmental influences. He stresses that trauma is not necessary or sufficient for developing such disorders. People can develop these traits without adverse childhood experiences, and conversely, many with difficult upbringings do not develop them. The persistence of such seemingly maladaptive traits in the gene pool suggests possible evolutionary advantages or functions. Dr. Salerno posits that traits typical of cluster B personalities may have been useful in specific contexts, such as quick, impulsive decisions or gaining immediate rewards. Some traits might appear harmful in excess, but advantageous in moderation, paralleling how extreme agreeableness could be counterproductive in certain situations. While randomness accounts for some variation, evolutionary utility and survival advantages likely help maintain these traits in human populations. Delving into neurobiology, Dr. Salerno explains that differences in brain structure and function, particularly in areas related to empathy, self-control, and fear learning, contribute to cluster B behaviors. For example, some individuals show decreased fear response or impaired processing of consequences, making it harder for them to learn from punishment. This neurological makeup can lead to proactive aggression and exploitative behavior, as such individuals lack internal deterrence to harmful actions. He notes that while brain imaging shows changes post-therapy in some cases, personality disorders are probabilistic rather than deterministic, meaning change is possible, but often difficult. Working clinically with cluster B individuals is complex due to transference, feelings patients project onto therapists, and countertransference, therapists' emotional reactions toward patients. Dr. Salerno describes common therapist experiences of sudden feelings of incompetence, dread, or fear when sitting with these patients, which are reactions to being subtly devalued and manipulated. These dynamics can derail treatment as the manipulative patient exploits therapist empathy to control the therapeutic process, often without explicit awareness from either party. Personality disorders are described as egosyntonic, meaning individuals feel comfortable with their traits and see no internal problem to fix. Consequently, there is little intrinsic motivation to change behavior, and their manipulations are often natural extensions of who they are, much like introverts cultivating environments suited to their nature. Their actions may not always be consciously malicious, but are nonetheless intentional means of achieving desired outcomes, such as attention or control. Dr. Salerno explains that personality disorders are divided into 3 clusters based on characteristic traits. Cluster A includes odd and eccentric personalities, such as paranoid, schizoid, and schizotypal types. Cluster B involves dramatic, erratic, and manipulative behaviors. Cluster C consists of anxious and fearful personalities like avoidant, dependent, and obsessive-compulsive personality disorders, distinct from obsessive-compulsive disorder. While the clusters differ in trait focus, they represent overlapping parts of human personality pathology rather than disparate universes. The popular saying that trauma always causes personality disorders is challenged as an oversimplification. Dr. Salerno emphasizes that this narrative is attractive because it is hopeful and empowering, suggesting childhood environment alone shapes outcomes and can therefore be controlled or corrected. However, the scientific evidence indicates a complex interplay of genetics and environment, and accepting biological predispositions is difficult but necessary for a clearer understanding. Narcissism is outlined as excessive investment in a preferred self-image lacking an authentic core, rather than a disorder based on low self-esteem. The grandiose narcissist openly believes in their superiority and entitlement, whereas the covert or vulnerable narcissist conceals similar grandiosity behind apparent vulnerability. Dr. Salerno disputes the common view that vulnerable narcissists suffer from hidden shame, suggesting instead a shared intrinsic grandiosity expressed differently. Furthermore, research aligns covert narcissism more closely with borderline personality disorder traits rather than shame. A hallmark behavior among narcissists is idealizing or devaluing others in black and white terms, with little ability to tolerate ambiguity. They don't see partners as people of worth, but as tools serving their utility. This results in patterns of love bombing followed by sudden discarding. Their relationships are transactional, measured by usefulness rather than emotional reciprocity or equality. Psychopathy is differentiated from narcissism primarily by the degree of exploitation and lack of regard for human life or honor. Psychopaths exhibit active grandiosity and retaliatory aggression, whereas some narcissists demonstrate passive grandiosity, indifferent to consequences for others. Psychopathy lacks effective treatment and is best managed through containment, highlighting its severity and resistance to change. The overlapping yet distinct concepts of narcissism, psychopathy, Machiavellianism, and sadism, the dark tetrad, are explored. Not all narcissists are psychopathic or Machiavellian, but all psychopaths tend to be narcissistic. Sadism is described as deriving pleasure from others' suffering and is closely associated with psychopathy. These traits form a continuum with varying degrees of interpersonal harm and manipulation. Among personality disorders, psychopathy is noted as the most difficult or impossible to treat effectively. Grandiosity inherent in narcissism creates profound barriers to change because individuals do not perceive a problem with their self-view. These personalities are essentially therapy-resistant, as their self-concepts preclude motivation to alter behavior. Cluster B individuals often begin relationships through charm and mimicry of prosocial emotions, love bombing their targets by reflecting back shared values and interests. When inconsistencies or slips arise, victims often deny or rationalize behaviors due to confirmation bias. Manipulators exploit this natural inclination, steadily eroding boundaries and fostering dependency. Attention control operates as a key lever, as victims unconsciously reward behavior that confirms their hopes. Contrary to common assumptions, victims are not defined by pathological vulnerability or childhood trauma. These manipulators are opportunistic and will engage a wide variety of people, often selecting those who demonstrate enough emotional resilience to stay invested long enough for manipulation and exploitation to develop. The key factor is ability to sustain relational investment rather than inherent weakness. Flirting is wielded as a deliberate tool of manipulation by cluster B personalities, functioning as a weapon even when authentic attraction exists. They use charisma and seductive behavior to lower defenses. Physical attractiveness varies widely and is less relevant than the intense self-concept and conviction they project. The difference between arrogance and confidence matters. Narcissists often blend these, projecting assuredness while lacking genuine competence. Cluster B personalities seldom demonstrate sustained collaboration, accountability, or genuine remorse. Even performative displays of these behaviors are limited and inconsistent due to their compromised capacity for long-term empathy and self-reflection. Neurological soft signs, subtle behavioral and neurologic indicators may help experts assess underlying pathology, although this is specialized knowledge. People in emotional pain can nevertheless choose to hurt others, but Dr. Salerno stresses that personality disorders are not merely reactions to trauma. Hurt people do hurt others, but the presence of personality pathology involves intrinsic trait configurations that go beyond situational distress. Dr. Salerno engages in a thought experiment about how certain developmental approaches might exacerbate cluster B traits, assuming biological predisposition exists. For narcissism, persistently challenging a child's sense of superiority while rewarding tantrums with nurturing may worsen grandiosity. For borderline traits, invalidation and threats of abandonment intensify fears. For histrionic traits, denying attention fuels extremity. Antisocial traits seem less modifiable, indicating the potency of intrinsic biology. Differences in the expression of personality disorders between males and females often reflect cultural and social gender norms rather than innate trait differences. Although features like physicality or interpersonal skills vary between sexes on average, the core pathological traits appear sex-neutral. Individuals may deploy gender stereotypes strategically to enhance their manipulative effectiveness within social expectations. Dr. Salerno acknowledges the compelling and sometimes alien nature of studying these personalities, describing them almost as a different species within humanity. He underscores the importance of awareness, detection, and avoidance rather than moralizing or futile attempts at reforming such individuals. His work aims to illuminate their operation both for professionals and the public, fostering understanding that can help people protect themselves.